Hello, everyone. My name is Dr. Karen Ortega. I'm a pharmacist and a university professor. And today we're here at the beach, right, to learn about choosing a contraceptive for postpartum patients. Not every single contraceptive method, not every single birth control method is going to be right for every single patient. Therefore, we're going to be looking at a few contraceptive options. One of the concerns that we have with patients after they give birth is that they're going to be in a hypercoagulable state. So that means that they're going to be at risk for clots, for blood clots. And these include putting them at risk for a VTE, a venous thromboembolism, which include a DVT, a deep vein thrombosis that can turn into a pulmonary embolism, a PE, which can be fatal in worst case scenarios. Therefore, if we're able to avoid these risks, then we're going to choose a contraceptive that is not going to put our patient at risk of these adverse effects. Therefore, we have a serious adverse effect of a VTE, and then we have less serious but still annoying side effects. So, some forms of birth control can put our patient at risk for producing less milk. So, if our patient wants to breastfeed, and this contraceptive causes them to produce less milk, that's not ideal. So, not as serious as a VTE, but can still be bothersome for our patients. So if we're able to avoid that, well, why not? As we go through this presentation today, I want you guys to think about which contraceptives are preferred postpartum. So after they give birth, which contraceptives may we prefer and which ones should we avoid? By the end, I want you all to have accomplished these two things. So I want you to be able to evaluate different postpartum patients based on their patient specific factors. So, such as days after delivery, their breastfeeding status, do they already have VTE risk factors, and then determining which agent should we select based on our patient factors. So, we're going to mainly focus on two main classes of different birth controls, some that contain estrogen and then some that are estrogen free. Now, when we think about our different forms of birth control, we have some that have estrogen and then we have some that are estrogen free. When it comes to estrogen, the main concern that we have is that it can put our patient of these adverse effects, right? So the VTE and then the possible decrease in milk production. And this risk is highest, especially the first few weeks after giving birth. So those 21 days after a person gives birth, our patient is in this higher hypercoagulable state. So meaning they're at higher risk for clots. And our birth control methods that contain estrogen can come in different forms. It can come in combined oral pills, it can come in patches, vaginal rings. So there's not just one form of estrogen containing birth control, there's multiple forms, and we're gonna check some out. So here I have some examples, right? So I have some combined oral pills, the Loloestrin, I have a patch, the Sulane, I have a vaginal ring, NuvaRing. All of these contain estrogen. And how I know that they contain estrogen is, so if we look at the box, if we just have access to the box, or if we're looking online at these medications and we look at their name, we see this component ethinyl estradiol. This ethinyl estradiol is letting us know, okay, this medication has estrogen in it because of that estradiol component. So even if you don't need to memorize brand generic, you could simply look at the box that the medication comes in and then look for that ethinyl estradiol component. And so we have multiple forms. Estrogen containing contraceptives come in many different ways. Now we have our estrogen containing birth control options, and we also have our non estrogen contraceptives. So, our non estrogen contraceptives are the ones that are preferred postpartum. And how we're able to identify these. So, if you look at this table that I have right here, I have different examples, right? So, I have the brand and then I have the active ingredient in those medications. From the medications, you can see that there's only one agent here. So, like levonorgestrel, medroxyprogesterone, norethindrone. So all of these are only a single ingredient. So that progestin only ingredient that we have that we didn't see in our previous examples that have with our combined hormonal contraceptives that have that ethinyl estradiol. We have multiple options for our estrogen free. We have IUDs, we have implants, we have injections, we have the progestin only pills, which are also called mini pills, and then hormone free like condoms and spermicide. Now, the only thing about this table, IUDs, especially after giving birth, we usually want to avoid putting anything into the vaginal canal. But for example, if a patient wanted to, if a patient gives birth and they're like, nope, I am done having kids, and they wanted to get the implant, the Nexplanon, you could do it right there after at the same hospital visit after the patient gives birth, and you wouldn't be putting your patient at high of a risk compared to the CHCs that contain that do have that VTE risk. Another thing to consider when we're thinking about what contraceptive to give to our patients is how much time has passed. So the first 21 days postpartum, this is when we want to avoid all combined hormonal contraceptives since they are in a hypercoagulable state. After those 21 days, another thing that we can consider is breastfeeding. So, especially when breastfeeding is still being established, combined hormonal contraceptives can interfere with breast milk production. And so, we just want to avoid them at least during that initial period. After those 30 days, you may want to think about, what's your patient's age? Are they above 35? Are they a smoker? Are they obese? These different factors that are already putting them at risk of having a VTE event. And if they are if they do have all of these risk factors, then you might still want to avoid them within those 42 days, which is about 7 weeks. And then after those 42 days, the patient's body has stabilized a little bit more. Therefore, your options to prescribe a combined hormonal contraceptive or an estrogen free contraceptive option, also a progestin only birth control option, you have more freedom between the two. And that's a conversation you have with your patient. Which one would they prefer? Which one would be more convenient? Which one would decrease adverse effects? So they all have benefits and risks. So I have this case right here for you all where I have this question: which of the following contraceptive options would be most appropriate for this patient? And then we have our patient. So she's a female, 36 years old. Chief complaint: I would like to start contraception as soon as possible. Background or patient history: recently delivered a healthy infant, currently breastfeeding, no history of VTE reported, no medication allergies reported, and current findings postpartum day 2. Breastfeeding is being established, and the patient desires immediate contraception. So I want you guys to look at our different options. So we have A, low estrogen, B, the NuvaRing, or C, Nexplanon, or D, the Sulane patch. And I want you to take a minute. You can pause the video and think about it. Go back to earlier parts of my video. That way you could look at the different options that we have. So I'm going to assume that you had a go at it already. And so if we look at our different options, our best option in this case would be the Nexplanon, the etonogestrel, which is the arm implant. And the reason why is because this is our only estrogen-free option. So if you go back to my earlier slides, we can see that the rest of our options all contain that ethinyl estradiol component, right? And so our Nexplanon is the only one that is estrogen free. 3 questions to ask your patient when recommending contraception. So first, how many days postpartum? We saw that time was an important factor. We can also ask about breastfeeding. So are you planning to breastfeed? And then lastly, number 3, asking about other VTE risk factors. So if they smoke, if they are older than 35, if they already have a history of having a VTE, if they are determining if they're obese, determining if they have other risk factors, like maybe they have a health condition that causes them to be in a hypercoagulable state already. So all of these are reasons why you may want to avoid estrogen-free contraception, especially those weeks immediately after giving birth. Our takeaways for today is for our early postpartum patients, we saw that we would want to consider using estrogen-free contraception first before going to our estrogen-containing contraceptive methods. And we have multiple options. We have injections, we have pills, we have implants. After that time period, then we can go back and reevaluate if, different birth control options may be appropriate for our patient. And here are my references in case you want to check those out. And let me know if you have any questions in the comment, but I'll see you next time.